Canada reached a very disturbing milestone yesterday, 200,000 cases registered officially, and that is prompting more appeals from health officials to do more to act, to download, for example, the federal government's COVID alert app. The numbers coming out from Hotspot Ontario show just a small fraction of new cases are being reported through the app, and Laura McQuillan is here with just how low, in fact. Laura, good morning.
Good morning, Heather. So the app rolled out on July 31st in Ontario. Since then, there have been about 25,000 confirmed cases of COVID-19, but only 1,300 of that 25,000 have been reported through the app, which notifies the people around you that you have tested positive. That works out to about 5%, a pretty low number, and it means if people aren't using the app or if they're not inputting that code that you get given when you test positive, it's not helping the app be particularly effective. But we are hearing from public health experts and technology experts who are saying don't write off the app as a failure. One of those experts is an epidemiologist from the University of Toronto, Susan Bondy. She told us that the point of COVID Alert is to help those manual contact tracing efforts, which have been swamped in parts of Ontario, not to replace them. Here's more of what she told us.
It is not going to resolve the problem of the entire workload capacity issue of contact tracing, but it is one link in the chain. People have reported to their network of friends through social media and others that they have received a notification. So the impression of risk, which is very important, makes people more personally aware of the risk that they're
So perhaps a bit of a wake-up call from getting that notification on your app. Now, we don't know how many downloads of the app there have been in Ontario. We do know the number for the entire country is about 4.7 million. That's in 8 provinces that are using it, about 12% of the national population. And we had been hearing when the app was being rolled out, it needed to get to 60% to be really effective. Now experts like Susan Bondy are telling us, don't worry about that 60%. Let's just see how the app goes with both giving people a wake-up call, but also with that contact tracing. Just to note, by October 1st, about 600 cases nationwide had been reported through the app. Last week, that number was more than 1,500. So you can see that spike in October alone of people using the app more. The message, though, is that people really need to download it and to make sure that they use it if they do test positive to help make it effective for everyone, Heather.
Why aren't people using the app to the level experts want, Laura?
Yeah, a few different reasons for it here. Some things that we learned as it was being rolled out. It only works on an Apple or an Android phone that is 5 years old or less. There are also those privacy concerns that seem to remain despite those efforts from experts to assuage those. You know, it works over Bluetooth, your phone. If it sits within 2 meters of someone else's phone for more than 15 minutes, the app will notify them if you test positive, but it's not going to tell them who you are or where you were when you had that possible contact. We heard more on that front from Ontario's Associate Chief Medical Officer of Health, Dr. Barbara Yaffe, yesterday.
Need more people to download the app. It's a very privacy focused. There's no way that you can be identified. There's no way to tell where you were, who you are. And so it's important to reassure people about that and say that, yes, you have to download the app, otherwise it won't work.
Yeah, so to be effective, it really does need people to take it up. Getting it to be top of mind for people as well as the other challenge, but we are now seeing Ontario's government partner with some big names, the Raptors, the Maple Leafs, big banks, some media companies, to get the word out about the app, encouraging people to download it. And the thinking is, as we see more cases in Canada and we see those struggles that contact tracers are having, that more people will be thinking perhaps it's time to download the app, and all of that will make it more effective across the board.